Ah!
Hey, fruitcake.
Hey, fruitcake. I've definitely been called that by a patient once or twice.
You're pushing your luck today.
No, you're pushing your luck, ma'am, because I really don't like your attitude. What's up, everyone? It's Nurse Blake, and welcome back to my channel. I'm going to be reacting to episode 2 of The Pitt. Now, this is a reminder that The Pitt, the whole season, is done by hours. So episode 1, we watched the start of the shift, 7 a.m. And now episode 2 is 8 a.m. And while it doesn't represent, I think, like what a real 12-hour shift looks like for nurses, it does give the general public some idea of how busy and wild it could get at any hour, so you always have to be prepared. And I just want to congrats to all the cast and crew for your Emmy wins. I know you were nominated for 13 Emmys. You all took home and scored 5. So congratulations to Noah Wiley and all the cast and crew. Y'all deserve it. Let's get in. 8 a.m. episode 2 of The Pitt, season 1. Let's go.
Where are we going now?
We need the room for someone else, but you can rest in the hall till we get your labs back.
Got something?
68-year-old male, history of hypertension, 1 hour of right upper quadrant pain after eating a fatty meal, now resolved. Afebrile, non-tender. There was a gallstone present on POCUS. EKG shows no acute ischemic changes, but I'm still waiting on LFTs and lipase.
Why did you order the EKG?
The nurse suggested it to rule out any cardiac issues.
Well, good call on both your parts. Nurses know what they're doing. Never hesitate to listen to them.
Nurses know what they're doing. Never hesitate to listen to them. You hear that? And this is definitely something that all residents need to hear. So in the United States, typically residents start on July 1st. It is a very scary time for residents because they are coming into a new environment. They're having to make calls on really important issues that affect people's lives. But so many times the nurse who has years of experience will say something that the resident doesn't like, and then ego gets involved and the resident doesn't listen to their nurse, and then something bad could potentially happen, right? So the fact that an attending is like, listen to your nurse is so important.
Your father has pneumonia and a condition called sepsis. So your father came in with low blood pressure, which is improving.
Can he go back to assisted living?
Eventually, we hope so. Your dad has an advanced directive expressing his wishes, which says that IV fluids and medications are okay, but no artificial life support, no CPR.
He doesn't want a bunch of machines keeping him alive.
Then we will continue with oxygen and IV fluids and antibiotics. But if his lungs stop working, we're not going to place a tube in his windpipe for a breathing machine.
But pneumonia is treatable.
Most of the time it is.
But if he can get better in a week, then put him on a machine.
That's not what he wanted.
Do either of you have durable power of attorney for healthcare?
Yes.
We both do.
23-year-old Ben Kemper, no helmet, got doored riding an e-scooter. Neck versus handlebar, then face planted to the pavement. Obvious facial fractures, but alert and oriented with good vitals.
How we doing, Ben?
One. Back in my throat.
That's probably from the nosebleed. Short, rapid rhino, please.
Tachy at 120, pulse ox borderline at 90.
Blood by at 15 liters for now.
Neck contusion, larynx shifted to the right, no crepitance.
4 of morphine.
What's up?
Good vitals. A&O. Let's have a look. Ouch. Floating face.
A 4-3 fracture.
You don't see that every day. Okay, let's prep for an airway. Double setup just in case.
You could just feel the tension, like in the room. Like cases are coming in, they're caring for patients. Everything's fine for the most part. So they're going from case to case, patient to patient, but you just feel like something's brewing. And a lot of times in the hospitals, you will also get that same feeling. Like it's kind of slow, it's kind of quiet. And we have this thing in nursing where it's like, if you're working and it's slow or quiet, never say it's slow or quiet, because guess what? It's gonna hit the fan and it's not gonna be quiet anymore, and it is not gonna be slow anymore. It's gonna be fast, dirty, and nasty, and it is gonna be in your face.
Hey, fruitcake.
Hey, fruitcake. I've definitely been called that by a patient once or twice, so I could hey, fruitcake.
Hey, I'm talking to you, fruitcake.
Burn up. I've told you 100 times. My name is Dr. Robbie.
You want to see my vagina?
I have already seen it, and once was enough. Thank you.
These moments between patients and healthcare workers, it's so funny. And a lot of times patients will be inappropriate, but just like his like little correction, like, my name is Dr. Robbie, like, my name is Blake, I'm your nurse, don't call me fruitcake, even though I find it funny. Sometimes you have to check your patients a little bit. And no, I don't want to see your vagina or penis more than I already have to. So ma'am, no thank you. This fruitcake does not want to see your vagina again.
Yeah, really distorted from the trauma, and the demon's only going to get worse.
Which is why we should crike.
You don't crike a laryngeal fracture. Don't listen to Edwina Scissorhands here. If they can't cut it, surgery doesn't know how to fix it.
The contusion is high at the thyroid cartilage, so you just stand there looking pretty, ER Ken, and let me fix this.
I've never done a crike before.
No, Mel will do the crike. You've already had a busy morning. Glove up, Mel.
No, I'm doing the crike, doctor.
You would be doing it, doctor, if it wasn't an odd day. Surgery gets even days, ED gets odd days. You know this. For crike's sake.
It's because you're all odd down here.
Okay, teamwork, please. Let's focus on the patient.
Nurses and doctors don't train together. A lot of times it's like doctors focus on medicine and nurses focus on the nursing aspect, which nursing and medicine are two different things, but they overlap, and doctors and nurses have to work together. So I never know the real reason why we don't have some classes together, or at least do clinicals together, or just even meet each other. Like, what happens is nurses start on the floor. That's where we meet doctors for the first time, is like during clinical. It's like, hi, you're the doctor. Hi, I'm a nurse. It's like, no, we need to be training alongside with each other, which I think would prevent a lot of these issues from happening when we're actually like on the job and have to work together. So to any deans out there, or deans of medical schools or deans of nursing colleges, please have us work together. Bring us together.
You ready? Hello?
Oh, hello.
You've done this?
Yes, in the cadaver lab.
Let's hope that's not where this poor soul ends up. We'll do an open technique since we have a minute.
Okay, you're gonna be making a vertical incision to avoid the jugulars and the carotids. Good. If this was a crike that needed to happen in seconds, you could use a 10 blade, your finger, and a bougie.
Oh, excuse me.
No worries.
End tidal CO2 is yellow.
Yellow is yes. Nicely done. Sew it in. Okay. I will be next door.
God, you just feel the tension, like whenever a procedure like that happens, it does get quiet. Like those trauma bays, it gets quiet. And then once it's in or something's good, you're just like, okay, we got the patient. They're stable-ish for now. We completed that box. Let's see if we could get to the next box. So that tension is so real.
Just received word your son's head CT is normal and he's maintaining a good heart rate.
You got him back.
Blood pressure.
Thank you, thank God.
Right now, he's unconscious with a tube in his throat for oxygen. Why don't we step out for a minute while they get him settled, and then you can come back. You can sit with him as long as you want.
Nikki, it's Mama. I'm here, babe.
You're doing great, son.
Blown.
Okay, let's step outside.
Blown pupils, never a good thing. Not a good sign.
So, we don't know how long he was at home without breathing.
He's breathing now.
Not on his own.
But he's gonna wake up.
We certainly hope so. We're gonna know better after we get some more test results back. Are you sure that he didn't take anything that could have caused this?
No, he's a good kid. He's in college. He has a part-time job. He even chose to live at home so he can focus on school.
Dr. Robbie from the urine.
What's that?
It's a drug test, and it is positive for fentanyl.
No, that isn't possible. Nick doesn't do drugs.
There are a lot of pills that are sold illegally that have fentanyl, not just painkillers. Xanax, Ativan.
No, not our son.
Well, maybe he didn't know that he took something with fentanyl. I don't know. The hows and the whys don't really matter.
Can he hear us?
You know, we're never really sure, so you should just assume that he can. And can we move Nick Bradley to a private room?
Like you're gonna make it? Didn't you respond to Narcan?
I think his pinpoint pupils just grew into blown pupils from brainstem death. Yeah.
And I definitely want to congratulate the nurse leader who plays Dana Evans as the charge nurse on the Pitt, Catherine Lanassa. Congratulations on your Emmy win. We love seeing good nurse leaders and good charge nurses get rewarded, not only in TV, but also in real life.
What's BiPAP?
It is a pressurized air mask that can improve his oxygen. Either his pneumonia is getting worse or his heart couldn't handle the fluids that we gave him to treat the sepsis. His lungs are filling up with fluid.
Can't you take the fluid away?
Not without his blood pressure crashing with very bad consequences. So let's just hope the BiPAP works.
And if it doesn't?
Then I would need to know your decision about using a breathing machine.
We're still talking about it.
Well, we know he expressed his wishes in writing. Do not intubate.
We're thinking try it for a week.
That would be a very painful week. He wouldn't get a lot of rest with all the monitors and all the blood tests. He might need to be sedated. He might need to be restrained because he'd be in an unfamiliar place with a very uncomfortable tube down his throat. And he wouldn't really know what was happening.
But he might get better.
Or he might get worse.
Deaths always get so messy, especially if it's unexpected. This was an older gentleman. Obviously, he did have some things in place where he had his wishes written down. I think you should always follow what the living will says because that's what the patient's wishes, that's what they wanted. But of course, the kids are here and they have, power of attorney. So, I mean, it's such a hard thing. And I tell everyone, like, no matter what age you are, no matter how healthy you are, it is always so good to have this written up, to talk about it with your family, like right now. If you haven't had these conversations already, do it now. Do not wait. I think it's something families should do together, actually. If you've not talked about death, if you haven't talked about your wishes, if you do get ill, and it could be something that's so fun. I had my grandmother over recently. We went over my living will, power of attorney, all that stuff, made my wishes known to her. She had her wishes, made them known to me. So we were able to get on the same page because at any point, anything in life can happen, and death is normal. It happens to everyone. So have these conversations. Don't wait until it's too late.
At the risk of seeming...
Then you probably shouldn't.
And I just...
No, trust me.
How do you know?
I just know.
I just wanted to...
I know. I'll let you know if she says anything else that could be important to your investigation.
Thank you. No, for the record.
Nope.
Doctor, listen, that is a cop. That is police. You know, healthcare workers, we are supposed to stay away from the P's, okay? Police, firefighter, paramedics, okay? It's always the relationships that are like such a red flag. It's the ER nurse with the cop. I know... They're just both really, really hard professions. And I think we're just automatically like attracted to each other. Like, number one, because they're really hot, right? And just like a man in uniform is like so sexy. So the fact that he's flirting with a doctor too, it's not good. It's not good. By the way, if you're a nurse or healthcare worker and you have dated a cop, a police, or firefighter, please let us know how that went or how that's going. So drop all your love stories in the comments below. Not even love story, just like sex stories, because we love a good sex story with a cop.
Is it me or was that opposite?
No.
What? You don't even know
what you were gonna say?
Maybe you do. You seem nice.
Absolutely.
Ah! They were flirting. It's confirmed. Dr. Robbie was like, he seemed nice.
There is no possible scenario in which you and I have this conversation. You, of all people, should know better.
I was...
No. Just walk away. Best possible scenario, just keep on walking.
Nurses, cop, firefighter, paramedic starts to flirt with you. Best scenario, just keep on walking, okay? Keep on walking. Away. Away.
Hey, you, pasty white. How about a sandwich?
What brings you here today, sir?
I'm here for a sandwich.
Okay.
Always want a sandwich. Always want a turkey Sammy or a warm blanket. I get it. I get it. Sometimes the turkey Sammys are good. Sometimes they're expired. You never know what you're going to get or if your hospital's having budget cuts, okay?
Okay, excuse me.
Perla?
Perla, can this patient get a sandwich?
I already gave you a sandwich, bro.
I ain't ate this whole week.
Sure, give him another sandwich. They're on the food cart. Just make sure it's not egg salad or he'll throw it on the floor.
Okay, good to know. Thanks.
Caucasian male, approximately 60 to 70 years old, found unresponsive. No signs of trauma, no ID.
John Doe, Jane Doe. So whenever you have a patient come and they're not identified, they don't have ID, we typically list them as John Doe or Jane Doe until social work comes in or a case manager that can help us identify them and at least give us a name.
Did you take anything?
Smell the alcohol from here.
This guy's wearing the spring, summer, and fall collection.
And listen, when you come into the hospital, especially if you're a trauma, we cut your clothes off, especially if you're really, really injured or unresponsive. That's what we have our trauma shears for. The first thing that's coming off is your clothes. So if you're ever planning on getting an accident, which you should never plan on getting an accident, make sure you're wearing clothes that you don't mind we cut off of you.
Jeez. What's wrong?
Not the rats coming from listen, again, you never know what you're gonna see in the ER. You never know what you're gonna get. The fact that those mice and rats just came from, I've seen bugs on patients. I've seen lots of things on patients. Never rats or mice. But hey, you never know what you're gonna get.
Because your son tested positive for THC, the psychoactive ingredient in cannabis, we're gonna have to admit him for overnight observation and monitoring.
Hello, I'm Kiara Alfaro. I'm the department social worker.
Kiara will help you navigate the next steps.
We love a social worker. Shout out to all the awesome social workers out there.
What steps?
Well, a case like this requires mandatory reporting to child services and sometimes law enforcement.
No.
Why do you have to involve the police?
It's a controlled substance.
They're not taking my kid away.
They were pot gummies.
Well, your suggestions. No one is touching my child.
Ooh.
Don't you dare touch me. Get out, all of you.
Whoa, what's going on?
Mom's worried about a CYF.
Amanda!
Okay. This is a hospital. This isn't the Jerry Springer show. Ma'am, nobody's trying to take your child, so why don't you stay here with him while your husband talks to our social worker outside and straightens all this out?
Well, I don't want him speaking for me and my son.
Well, it is either you or him. Your son is not leaving, but you can be escorted out and even arrested if you refuse to cooperate. Nobody wants that.
Woo! Gets wild in a hospital, especially with the family dynamics. Seen this before, it gets really messy. I am a big fan of the approach Dr. Robbie has here because sometimes it's not all smiles. It's not all lovey. Like, your son is sick in the hospital because of something that happened, and now we're going to do our best to care for him, and it's not going to be about you right now. This is still about your son. And so many times families take their emotions, they make it a bigger thing, and I get it. That's probably really, really scary for her as the mom. So I get where she's coming from, but that's still not an excuse to kind of blow up on staff in a hospital. It's a lot. So sometimes you have to just be like Dr. Robbie and just spit straight out facts without a smile. This isn't a hotel. You're in the hospital, okay?
Is it true? You have to be more specific.
Are there rats in the ED?
Apparently, if somebody already snitched.
Do you know how bad this looks? One more reason to shutter this place. Only the emergency department admits
The emergency
rats.
department would never admit rats unless they had the right insurance.
Did you catch any of them?
One, and I charge them for a full visit.
I'm glad you think this is funny.
I'm sorry that you don't.
Did you call an exterminator?
He's waiting on a second opinion?
Here she goes again. Why does the doctor, the attending, need to call the exterminator? How about you get on the phone with the exterminator? That would be a big help because we're trying to save lives. And if you're worried that there's rats here because a patient was brought in with rats that they didn't know about, it's not their fault. Should we be taking all the clothes off of the patients like outside of the hospital? Like, how about what do you want to do about it, ma'am, since you're so invested in this, Miss Healthcare Executive?
You're pushing your luck today.
No, you're pushing your luck, ma'am, because I really don't like your attitude.
Drug-seeking woman kicked off a city bus for disrupting and disturbing passengers. She's been screaming for narcotics nonstop. We found an empty Percocet bottle 5 days ago.
Why can't you call it? He's been uncooperative and combative since we picked her.
Get off her, let her go.
Stop fighting. Calm the down or I'm calling the cops.
My meds at home aren't working. Please, I have sickle cell.
Okay, stop. Everybody stop.
Stop!
Oh, sickle cell? One of my really good friends from nursing school has sickle cell, and it is the worst pain ever. And so many times sickle cell patients come to the ER because they go into crisis and they need meds, but no one ever believes them, and they always want to start with something like Tylenol, like a low-level, mid-level pain medication, instead of giving them like what they really need. Sometimes it's Dilaudid, and everyone wants to avoid that word, Dilaudid. Oh, they're just coming in because they're drug seeking. Well, they have sickle cell. They're in like horrific pain.
Is this your sickle cell pain?
Yes!
10 milligrams of IV morphine.
You really want 10?
Yes, repeat it in 5 minutes if needed. And she needs a dilaudid drip. This is a vaso-occlusive crisis. I'm so sorry this happened. It's gonna be okay now. We're safe here. Come on. We're gonna be safe here. I promise.
And that's what hospitals need to be. They need to be a safe space for patients. So if someone's coming in with a condition like sickle cell, all the staff should really know how to treat that disease and that condition, which is giving them pain meds that they know that work. They've been through this before, so trust them. Oh, they shot this outside of Allegheny Hospital. I think it would be so cool to be a flight nurse and work on a helicopter. Oh, that job is so sexy, and their uniforms are so sexy. Ugh, maybe one day.
Ah! Sorry. Sorry. So what happened?
I bought it for my girlfriend's dog.
He's wearing a shock collar.
All right, I think we have a couple options, Gary. We can try to find a solvent that will dissolve or at least soften the glue enough for you to peel it off without taking your skin with it. Or,
I guess your skin cells on your neck will naturally slough off, and you should just be able to remove it in time.
How much time?
Couple weeks, maybe.
Couple weeks?
How's she doing?
Still breathing after 20 of morphine.
How's the pain, Joyce?
Oh, a little better.
Starting IV dilaudid at 4 an hour. You can press this button if you need a little extra.
That only works once an hour, though, so don't go crazy.
Could I confer with you?
Yeah.
You seem surprised by the opiate dosage.
Seemed a little high.
So was her pain.
How do you know she's not drug
You
seeking?
can't fake a hemoglobin of 6. Do you know what sickle cell crisis does to the body? Blood cells get caught and plug up your capillaries and deprive all your cells of oxygen. It's been described as an electrical stabbing pain that feels like it's breaking your bones and flushing glass through your body.
I never thought of it like that.
Little empathy goes a long way with those suffering in real pain.
Yeah.
Don't worry, you'll get good at spotting the fakers, and half the time all those people need is someone to really listen to them and hear their story.
Love this whole bit in the episode. I think every healthcare worker needs to watch this. You could definitely learn something for it. And I'm so happy she called him out. And she just did like a little, can I confer with you outside the room? To just a little check. And I think it's, sometimes we need to check each other, right? Even as healthcare workers, because sometimes you see something so many times, you can build a stereotype around things. Even things like frequent flyers, right? Like the unhoused person who keeps coming to the ER just for a turkey sandwich. Well, there's no services outside for them. Then they're going to go hungry, right? Then they're starving. So the only option for them is to come to the ER. Do we want them in the ER if they don't need to be there? No. Are they maybe filling up a bed? Yes. We shouldn't blame them. We can't blame a patient for having pain. Can't blame a patient for not having food and wanting a sandwich. Can't blame a patient for being in pain and wanting pain meds.
I am a savage, classy, bougie, ratchet, sassy.
This girl is killing me. Sassy, moody, nasty.
Moody, nasty. I am a savage.
I need help. I got stuff.
Can you guys help? What's your name?
Alex.
This happens more than not. This has happened at almost every hospital I've worked at where patients will come in with a gunshot wound and someone will just drop them off at the front and then drive away. I'm so happy they're covering this because this has happened at every hospital I've worked at.
Any allergies?
No. Morrison's a full blood. See that?
Yeah. Tore up his liver.
What's his name?
Alex.
Alex, you've lost a lot of blood. You need to go to surgery right away.
We're gonna die.
Not now that I'm here.
Spoken with humility of a surgeon.
Boy's ready. How's he doing?
He's coming up a bit.
Let's go. You call my mom? She's the ice on my stuff.
Of course, of course.
So he didn't have to wait for OR?
Nope. We're a trauma center. We always keep one OR stocked and ready to go.
Well, that's awesome.
This girl's cracking me up. Yes, and a lot of times the ERs like have a special elevator that will take patients right up to the OR.
What happens if there are multiple traumas needing OR?
We get a lot busier.
And there's actually different levels of trauma centers, trauma 1, level 2, level 3, level 4. I've worked at level 1 trauma facilities, but means that they have to have every service available for anything that comes in. So no matter what you get, there's got to be specialists there ready to work, ready to care, ready to save lives.
Oh, shit. I need a little help here! Help!
When did you check on him last?
I don't know, around half an hour ago at most. I was waiting on labs.
What's going on?
It's my gallstone guy. You saw his EKGs.
Unknown downtime, he was sleeping in the hall.
Okay, these are the worst chest compressions I've ever seen on a medical TV show. What is going on? The Pitt, come on. Do better than this, The Pitt.
I got it.
Hold compressions?
Hold compressions? You weren't even compressing. What's going on?
Asystole.
They did good. You cannot shock asystole. So many times medical shows will show a flat line, which is asystole. They'll shock that because I guess to the viewer or the general public, it's like, oh, we need to have a rhythm, right? But you have to have some sort of rhythm to shock. So typically V-fib, D-fib, you have some rhythm. You cannot shock asystole.
Resume compressions. Amp of epi. Slow tempo, slow tempo.
Should I intubate?
No, drop an LMA. We don't want to hold compressions.
What kind of compressions are okay, this is a TV show. It is 2025. There are so many, what is it, like the CGI technologies that should be able to show you giving much better compressions than this. Because I'm afraid like someone's going to need compressions like in the real world and the general public is going to want to help and give compressions like this that does absolutely nothing.
Pupils are fixed and dilated.
It's been down a long time.
How we doing in here?
So much better. Dr. Mohan, this is my wife, Undine.
A lesbian couple. We love to see the LGBTQ plus representation. So thank you, The Pitt. Those are not, I cannot, please stop with the compressions. We get it. But stop with the compressions. This is awful.
We switch out every few minutes. You can take a break.
Yeah, every 2 minutes, switch out every 2 minutes. And please switch him out because he ain't doing it right anyways.
No. People wake up from comas. You can wake them up. You can do that. You can stop.
It's so hard when a patient is brain dead and the families see them breathing because they're on a ventilator or a heart rate because we're pumping them with medications to keep their heart going. So they think that the patient's doing it themselves, but it's all mechanical. It's all medications. And when you take that away, things are going to stop and the patient is going to pass away. So, you know, a lot of times families need time to process this, but a lot of times there is not a lot of time. So it is hard to see. I worked in the ICU before in critical care, so we saw this often. It is so sad to see, you know, families go through this in real time. Did Dr. Robbie not foam in? Did he just walk into the room and put on gloves? Ah! You're supposed to foam in and out of every room you walk into. So this is from The Pitt BS. Obviously, I'm sure they can't show that every time. That would be so boring for the viewer to see healthcare workers foaming in and out of every room. But typically, that's what would happen here. When a doctor or a nurse goes into a room, they would typically foam in and foam out. Funny that this is the first time I'm like picking that up and realizing it, but it was super obvious in this clip.
This one could do it.
Good episode, not as eventful as the first episode. The show's pretty long. It's the 50-minute runtime. Love the show. Obviously, we caught some things here with the compressions, but I think the really important lesson for everyone that watches this show is the importance about advance directives and living will and having those conversations with your family and just talking about life and talking about death. So you prevent some of this drama that happens within families, that sometimes death not only does it bring families closer, potentially it also tears families apart. But that is episode 2 of The Pitt season 1. Again, congratulations on all the Emmy wins to the Pitt crew and the cast. You all are doing such a phenomenal job. Thank you so much for tuning in and watching this episode with me. My name's Nurse Blake. Don't forget to hit like and subscribe and let me know your comments below what you think of the TV show. I would love to read it and see it. Thank you again so much for watching. I hope you have a great day. Bye.